Hi, I'm Dr. Moore, and I want to talk with you today about why you can't lose the weight no matter what you try. Now, there's a chemical in your body, a hormone called leptin. And leptin tells your brain that you've had enough fat stored up. Fat is for energy, by the way, and you don't need to eat. And so you can burn calories at a normal rate. I like to think of it as the gas gauge on your car. When you have enough leptin, your brain sees it. It tells you that your gas gauge is full. You keep driving by the gas station. There's no need to fill up. There's no need to eat. But when you're on empty and you need more energy and your fat stores are empty, then it tells you your car, like the low gas gauge, it tells your brain you need to eat. You need to fill up. And so leptin also has a role in your immune system, your fertility, your brain, and its main role is long-term regulation of energy balance. It's all about the energy in your body. And so there's a little chart here. I want you to look at that because leptin talks about how it works with your bones and your cartilage, your immune system, your reproductive system, your kidneys, your bowels, your bladder, your pancreas. It has a lot to do with your joints and a lot to do with brain function. It's very important for brain function. So what happens when we eat? When we eat, we store fat from that food. It gets in our blood, we store the fat. Those fat cells secrete leptin in the bloodstream. That cruises through our bloodstream, goes to our hypothalamus of our brain, and our brain sees that we have increased leptin in our system. And so the hypothalamus of the brain says, with this increased leptin, signals our body to stop eating, and we then stop eating. We are satiated. We don't need to eat anymore. We're not hungry all the time. When we can recognize the leptin receptors tell our hypothalamus, hey, you got enough food in there. And so what happens with leptin resistance? Here's the difference. You eat food, you got that calorie coming in, you've got your fat cells getting bigger, making more leptin. There's a lot of leptin in your blood. And when this happens for a long period of time, over and over again, you become resistant to it. And so now it disrupts the signals to the brain. Now, instead of hearing all of it, you have the receptors in the hypothalamus, and you can hear it. Those receptors are kind of squished because they become resistant to the leptin. And you don't hear that signal, and the brain thinks, hey, I have low levels of leptin. I need to keep eating. And we keep on eating. And we're fatigued, and that causes inflammation in our system. That's leptin resistance. We don't hear the signals. It's still there in great quantities. It's still there. We just don't hear it. And our brain thinks we need to eat. It's like the gas gauge on our cars always says empty, but it's not. And so, people who are overweight, they got a lot of fat in their fat cells. And so fat cells get bigger. They got a lot of these big over-fat cells, and they produce a lot of leptin as a result. And there's a whole lot of leptin in the bloodstream. The brain doesn't see it. That's called leptin resistance. And so what causes leptin resistance? Well, inflammation is the primary cause. And inflammation in your body from an injury, from a trauma, from toxins, from anything in insulin resistance, any inflammation just aggravates your body because these little hormone receptors on every cell, not just your brain, by the way, but your whole body, they get all clogged up and inflammation beats up in your whole body. Also, when your fat cells are getting fatter, they secrete more free fatty acids, and this free fatty acids interferes with leptin signaling. And another reason why you have leptin resistance is a whole lot of leptin. And so what happens is your brain doesn't recognize the leptin signaling. It thinks you're starving and that you don't have enough food for energy, and you're hungry, you're tired, your appetite's going on, your motivation is low, because that's inflammation causes fatigue, and it decreases in the amount and it changes your metabolism, and everything is messed up. So when people go through weight loss, we're going to say, Dr. Moore, I lost 10 pounds in this weight loss program, but then it just didn't work. It's because the motivation's high. I'm gung-ho. I'm going to do it. Yeah. Let's do it. Boom, 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 boom. And I see that here. But what happens is after a while, they're not hearing that leptin. So they're hungry. They're tired again. The motivation is lost. It's, I don't feel like this is working for me. And it doesn't really work for you because it's that yo-yo dieting. Somehow or the other in your teens or your late teens, your 20s and 30s, your metabolism got flipped upside down through physical, emotional, chemical stresses, environmental toxins, stuff like that. And the leptin receptors are resistant. So what do we need to do? Well, we need to do a metabolic turnaround. We need to take this metabolism that's been flipped upside down and turn it around and right the ship. That's what needs to be done. We need to lower inflammation through the body. We need to improve leptin receptor so they can hear that, get your hypothalamus working. And we have a great program that does that, and people lose 20 to 40 pounds of unwanted fat in as little as 60 days. So how do we do that? That's your next question. How do we lower leptin resistance and increase fat burning? Well, we're going to use a healthy meal plan. We're going to give you healthy foods. We're going to teach you how to do that. We give you this food plan. We tell you how to get the foods at your grocery store. You're not buying stuff from me. You're buying it from the grocery store. And so we're going to also use a proprietary nutraceutical peptide. And what this is, it's basically amino acids, protein, that reduces inflammation, reduces insulin resistance, reduces leptin resistance, starts cleaning up your body so you become a fat-burning machine because you recognize, hey, I got enough fat. And so you're not hungry, by the way, because the receptors are working, so you're not hungry, and you're burning fat. And then we reduce inflammation in your body with the system. You're not eating inflammatory foods. We have the lipo drops that will help lower inflammation in your body, and we have coaching and support. Because you need somebody to talk to, and we need to be aware of it. We need to be aware of what's going on with you. And we do, most cases, bi-weekly meetings. We do this in person. We do it over the phone. A lot of my patients are over the phone. Some of them I've never even met. Because when it comes to weight loss, I don't have to see you in person. Also, this is a turnaround system. It's a turnaround. We're going to turn your metabolism. We're going to take this metabolism that's been flipped upside down. We're going to turn around, and that's what works so good. So this lasts. When you're done with our program, we've turned your metabolism around. Your life is turned around. You're enjoying eating healthy foods. You're living life on a wonderful plan. Your leptin receptors are free and clear, and the gas gauge says full, and the gas gauge works, and boom, everything works great. We're trying to clean up this mess of leptin resistance. If we can do that, you will get longer term results from the program. So I want to thank you for watching this. I just want to say thank you. God bless you. Have an awesome day.